A successful dental implant case presentation typically highlights the patient's initial clinical situation, meticulous planning and execution, and favorable long-term outcomes, that is, functionally, aesthetically, and biologically. Important things to consider will be patient profile, age, sex, tooth numbers, systemic illnesses or harmful habits, goal for the surgery or solution you will be providing via the surgery. Preoperative assessment of the patient, detailed clinical and radiographic evaluation, ideally a cone beam computed tomography assessment of patient's bone quality and quantity. Ensure patient has sufficient bone width and height, healthy surrounding teeth and soft tissues. Patient treatment plan may be immediate load, single, or multi-stage dental implant placement, and in what region. Ensure selection of appropriately sized root T titanium implant based on CBCT findings. Caution: patient must be informed of realistic expectations, risks, and the need for regular follow-up. Surgical procedure. Administer local anesthesia before incision. Osteotomy must be prepared using sequential drilling under copious irrigation. Implant placement should achieve excellent primary stability and patient's flap repositioned and sutured for tension-free closure. Postoperative care. Analgesics and chlorhexidine should be prescribed to the patient. Patient must be instructed on meticulous oral hygiene for an uneventful healing with initial soft tissue closure after 2 weeks. Prosthetic phase. After 3 months, radiographic and clinical evaluation must confirm a successful osseointegration. Impression should be taken for custom abutment and prosthesis. Then patient's crown is delivered. Patient follow-up is vital to ensure restoration provided is functional and that the aesthetics is comparable to natural dentition. There should be no signs of peri-implant disease, mobility, or bone loss after a 12-month review. Patient should report improved masticatory efficiency and satisfaction with the appearance. Key factors to guarantee implant treatment plan success. Ensure careful case selection and preoperative planning. Ensure use of CBCT for exact bone assessment. Ensure atraumatic surgical technique mastery and proper implant geometry. Ensure patient adherence to oral hygiene and regular recalls. Key clinical images to guarantee success. Preoperative edentulous site. Intraoperative views, osteotomy implant placement, radiographs pre- and post-implant at follow-up, final prosthetic outcome. Numerous case reports highlight that primary stability, guided bone regeneration as needed, and minimally traumatic technique are cornerstones of predictable implant success, even in demanding cases with bone loss or aesthetic challenges. Customization of prosthesis and emerging digital workflows also enhances aesthetic and functional results. Your implant case success is contingent on individualized treatment planning, patient health, and adherence to maintenance protocols. Long-term follow-up is vital to monitor peri-implant tissues and prosthesis integrity. Thanks for learning. Questions are welcome.